Hello, everyone, and welcome back to another exciting version of Chip Talks Health. Today, we're going to talk about insanity. What are your essential nutrients? What are your essential nutrients? What are the things that you need to run yourself every single day? You don't know. You know what? Your doctor doesn't know. Your dietitian doesn't know. The PhDs who train your doctor and your dietitian don't know. But we're going to talk about those things today. And we're going to talk about what happens to a population if you deny them essential nutrients. And we're going to talk about what happens to that same population if you restore those nutrients. But before that, let me give you a few of the things that you need to know. So a couple of things about how to find us or what we do. So if you're looking for essential nutrients, look right here at TrueMedics.com. We've got a package that's monthly. Again, if you're taking your essential nutrients, you don't really need to. Do you need a CoQ10? No, you'll build CoQ10. Do you need anything that's popular right now? Any of these mitochondrial supplements? Do you need a magnesium supplement? No, it's in our multivitamin. So a lot of these things that we think that we need, we don't need. And most things that we supplement with can be built from essential nutrients. So we'll save you some money at TrueMedics.com if you look at our essential nutrient package. Now, if you're in the Oklahoma City area, come see us at Neighborly Wellness. So we help people every day. So we help people with our information. We help people with our knowledge. And if you want to book a consult with me, you can do that at Neighborly Wellness. The other thing that we do is we try to educate. And so we have something called the ECS Education Academy. That is a very robust educational experience for people who are wanting to learn more about this philosophy. And honestly, you don't get any of this until you understand the endocannabinoid system. The way that health is taught right now in the medical system, it's fractional, it's siloed, it's very, you're learning about oncology, or you're learning about rheumatoid arthritis, or you're learning about the pancreas or whatever, but it's very siloed and it's not that holistic view of how you work. So we've built classes at the ECS Education Academy right here for physicians and for, research professionals. So if you're really interested in what the endocannabinoid system is, take a look at our classes and take a look at what we're offering there. Anyway, we'll jump into this now. And of course, I need to do a little housekeeping here before we jump over there. All righty, let me get to where I want to be. There we go. So what I want to do now is, so I want to walk you guys through what essential nutrients are. So let's start there. And again, your physician doesn't know this. So, and if you're a doc out there listening, again, I'm sorry that you weren't taught this. We all know what it takes in our car to get down the road, right? We need oil and gas and, in our car in order to get down the road. We know what it takes in our chainsaw. We know what it takes in our lawnmower. Why don't you know what it takes in you? Isn't that insane? To me, that's the most craziest thing that I have ever discovered in this health journey, is that I didn't know what my essential nutrients were, and nobody knows. And if you go put your doctor on the spot, do it. Provoke him. He should know. Every certified medical professional should know what essential nutrients are. How in the world am I going to treat disease if I don't know what your essential nutrients are? How are you going to get over cancer if you don't have your essential nutrients? How are you going to get over Parkinson's, Brad, Denise, if you don't know what your essential nutrients are? Sorry, that was a shout out. I just had a phone call with them asking about Parkinson's. So how are you going to know if you're going to get better if you don't have your essential nutrients? How in the world can you recover from severe disease? And listen to this, boys and girls, because this is the way that it works. We start with malnourishment. That little, and we'll talk about this as we go through the essential nutrients, where we're malnourished, because you'll get it right off. We start with a little bit of malnourishment. That malnourishment leads to barrier failures, which lead to infection, which lead to more malnourishment, which lead to more infection, which lead to more malnourishment. And somewhere out here, you begin to develop symptoms. Okay. So by the time your tummy's hurting, or by the time you get bloated when you eat, or by the time you feel like you got to poop every time you eat something, or by the time you're laying down in bed with all this gastric upset, or, you know, autoimmunes, or any number of stuff, by the time you're there, okay, you've walked a whole pathway that started with malnourishment. Now, I know what you're saying. You're saying, Chip, I eat 2,000 calories a day. I'm not malnourished. Really? Okay, let's walk you through this, okay? So what are your essential nutrients? Again, you don't know. So how in the world could you nourish yourself right off? Great, you ate 10,000 calories. Well, did you get any essential nutrients in that 10,000 calories? No, probably not. So what did that 10,000 calories do for you? Nothing. Zero. Nothing. Okay. So there are essential nutrients that we have to have every day. So what are those? Dietary fats, and in particular, omega-3 and omega-6 fats. Those are the most, you know, if an essential nutrient could be more important, if one could be more important than another, these two are the most important. Why? They fuel your master regulatory system called the endocannabinoid system. And guess what? If you disbalance these, so we should eat these in balance. We should eat omega-3 and omega-6 fats in balance. You guys are going to ask, where does omega-3 fats come from? Fish, okay, so fish, but also walnuts, chia seed, hemp seeds. But right now, we're so messed up that we can't really deal with omega-3 and chia seeds and hemp seeds and walnut, okay? So we almost have to come in with the fish oil or fungal, you know, DHA and that type of stuff. But anyway, that's where omega-3 comes from. So very limited sources of omega-3. It used to come from our meat, because our meat ate grass, which is a source of omega-3. You'd have to eat a ton of grass to get enough for you, but cows eat a ton of grass, right? And that goes into, or they're used to, that goes into their meat. So we used to get omega-3 from our meat supply. So let's say wild, you know, free range meat is going to have some omega-3 in it. Now, omega-6 comes from soy, corn, seed, canola oil, seed oils, okay? Seed oils. Now, and also from those grains. So what are we feeding our meat now? Our meat used to eat grass, which was a good source of omega-3. Now our meat eats corn and soy, right? Which is a strong source of omega-6. So what we've done is we've screwed ourselves like we usually do. We have screwed ourselves in our food supply, and we overconsume omega-6 and underconsume omega-3 right now in our food supply. So we'll look at what that does in a second, but just doing this right here, again, is going to whack you out like crazy, and we're all whacked out. This is measurable. You can go measure your omega-3 and omega-6 balance, but it should be 1-to-1, and at worst 4-to-1. Okay, 4-to-1, 4 omega-6s to 1 omega-3. We are now in a situation where we are 20 to 40-to-1 omega-6 over omega-3 heavy. That is horrible, horrible, horrible. Okay, so how do you fix it? Eat more omega-3. Easy. And you have to find a good source of omega-3. And right now, ALA, alpha linoleic acid, or linoleic acid, is not a good source. Not because you won't break it down, because you're so whacked out with omega-6. So what are good choices are EPA and DHA. And of course, we've got those at Trumatics, but find you a source of EPA and DHA. If you use ours, great. Fine. I'm not trying to sell you anything. go find a source of EPA and DHA. We have one, but find one. Okay. That's category 1. Category 2 is protein. Okay. Now, protein is nothing more than amino acids. So any protein that you eat is just a string of amino acids. There's 9 essential amino acids that we have to have. And if you eat 4 ounces of meat, you're likely getting the 9. So great. That should check that box, right? No. If you're whacked out omega-3, omega-6, again, you're going to get infected with something. As soon as you get infected with something, whoop, that pulls those 9 over into an immune response, and you don't have enough to build collagen. So really where we miss in protein, none of us get enough protein, but where we really, really miss is collagen. And because our bodies are so whacked out, we're not building collagen like we should. And every single visible sign of aging has to do with collagen deficiency. My hair turns gray because of collagen. My hair stops growing because it's growing back, though. I don't know if you could see, but it's growing back dark and pigmented, which is really cool because I'm adding collagen. But collagen is associated with our eyes going bad, our teeth, our bones, collagen, collagen, collagen. So if you don't believe that you're malnourished, how often do you cut your fingernails? If it's not once a week, you're malnourished. Okay. There's lots of other ways that you can kind of measure this, but all of us are collagen malnourished. All of us. You can't get enough. It takes 10 grams of collagen just for you to keep in front of your gut lining turnover. Okay. Now, how do we miss there? And why is this hurting us? Well, we used to eat tip to tail. So I'm indigenous. I'm native. You know, our people used to go out and we'd kill a buffalo and we'd eat that sucker tip to tail. We ate the brains, we ate the eyeballs, we ate the joints, we ate everything. But all that stuff has collagen in it, right? What do we do now? I do this too. I go to this grocery store and I get my ground beef and I look for the leanest ground beef I can possibly get. That's great for protein, but it doesn't have any collagen in it. It also doesn't have much fat in it, okay? Yeah, so we all miss with collagen. So number 1, omega-3 we miss. Number 2, collagen we miss. Number 3 category is vitamins, trace minerals, and metals. So there's several different trace minerals: potassium, iodine, chlorine, all those guys. And there are also several trace metals like iron, magnesium, chromium, all that. So, and there's vitamins that we all know about. So vitamins, trace, and metals, and there are classes of those that are essential. Where do we mainly miss? We do miss with the metals and the trace just because we don't get that stuff like we used. You know, water used to run down from the mountains. It would run through all of the ores and stuff that were coming out of the mountains. That stuff would be washed down into the fields. Plants would absorb that stuff and we would eat the plants. Well, it just doesn't work that way anymore. We've dammed up the rivers and we don't get the runoff, let's say, from the mountains and the minerals and stuff that we used to get. And we have raped our land, of really nutrient value and things like that. So where do we miss mainly? We mainly miss in water-soluble vitamins. So if you're a meat eater, you're going to get a little bit of vitamin A, vitamin D, vitamin E, vitamin K that's stored in the fat in your meat, and you're going to store some of those vitamins in your fat. But water-soluble things like B and C, if you're not taking them every day, you pee them out. And guess what? B vitamins, super critical in how you defend yourself. So again, without B vitamins, you're going to have a weak sauce border wall, let's just say, and it's going to be easy to invade you. With essential nutrients, we build this super strong border wall where it's really hard to infect us, and we're also really robust. Okay, so let's dive in and talk a little bit about essential nutrients, and I want to kind of teach you guys how to do something here because I really like being able to do this. So what I'm going to pull up here is just a chat dialogue. And I want you guys, again, if you've got a favorite AI tool, great. If AI scares you, I'm sorry. AI doesn't think. AI is just an advanced way to do an if, then, else statement. And I've programmed AI, so I know a lot about AI. But anyway, it's a really super good way to be able to take a bunch of different pieces of information and kind of put them together and present them to you. So this was my prompt. So I said, what would happen to a population? That's us. That's Make Oklahoma Healthy Again. That's MAGA. That's United States of America. That's the world. Okay, what would happen to a population if they overconsumed omega fats over omega-6 fats over omega-3 fats at a rate of 40-1? That's about where the food supply is at. They were collagen and overall protein deficient, and we all are, and they were deficient in B and C vitamins. What would their diseases look like? How would they fail physically? If you built a population on those things, the disease signature wouldn't look like one illness. It would look like systems collapse of barriers, membranes, repair capacity, and metabolic control. So we'd have gut lining failure, we'd have skin barrier failure, we'd have airway barrier failure, and we'd have urological barrier failures. Look at what this does. Gut lining failure, reflux, ulcer, IBS, food sensitivities, bloating, dysbiosis, chronic constipation, diarrhea, poor absorption. We seeing any of that in our population? Skin barrier failure, eczema, dermatitis, dry cracked skin, reactive skin. So if you take your finger and run it down your skin, it leaves a red mark. That's called atopic dermatitis, and that would be reactive skin. Slow healing, easy irritation. Airway barrier failure, chronic rhinitis, sinus mucus issues, asthma-like inflammation, frequent respiratory infections, urological, recurrent UTIs, irritation, dysbiosis, women's pelvic floor, prostate issues, ED issues, Okay, so the first thing that happens, omega-3, omega-6 causes membrane dysfunction. By the way, if you come into our clinic, we have this all staged out, so we'll tell you exactly what stage you're at. But membrane dysfunction is the first thing that happens, and this is the biggest miss, omega-3, omega-6, because this is literally associated with every single cell. So if we're eating 40-1 omega-6 over omega-3, that means every single cell inside of you is misconfigured 40-1 with omega-6 over omega-3. Your reactions, your immune system, how you function as a machine, let's say, is really only as good as that membrane in that cell. Cells use their membrane to store stuff, and they configure themselves with their membrane. So if you're just giving them the tools to configure poorly, then they're going to be poorly configured and you're going to have a poor result. So just the omega miss causes chronic low-grade inflammation, aches, fatigue, inflammatory markers trending up over time. Causes immune dysregulation. So more allergies. Again, you're tweaky. You're way more reactive, way more inflammatory than you should be. Pain. Okay, so pain shows up because of this misconfiguration. Pain comes from something called prostaglandin 2s. They are formed from omega-6 fats. There are resolving things that are formed from omega-3 that should mitigate pain. We don't make them because we don't have enough omega-3, okay? High vascular risk. So again, over time, endothelial stress, platelet signaling bias. So if you got some kind of weird blood problem, too many platelets, too few platelets, again, it's going to be related to membranes. Now, God is a perfect engineer, okay? And what I mean by that is cells aren't really, cells have states, so they just do things based on environment and kind of cues, and they have 8 different states, which is a bunch of different permutations. But still, a cell is always striving toward perfect form and function. No cell gets built to fail, and no cell gets built to strive toward mediocrity. Every single cell is striving toward perfect. It's the way that God designed you. It is God's design. It takes something for cells to fail. So, in situations where, we've got some kind of any kind of issue, platelets not working right, oxygenation of our blood not working right, that is not perfect design. There is a cause for that, right? There is some kind of failure mechanism that is causing that to happen. And it almost always goes back to infection or essential nutrients. It could be environment, but that's, again, some of it, but not all of it. Connective tissue failure, the scaffolding collapses. So again, when our connective tissue begins to fail, we have barrier failures, right? So we begin to have barrier failures in our linings, but this also looks like loose and painful joints, fragile gums and teeth, easy bruising, pelvic floor weakness. Again, for men, prostate, same thing, ED, early aging phenotype. So if your skin is thinning, that's not normal, and that is directly related to collagen, okay? Energy and metabolism, the slow slide into insulin resistance. So without B vitamins, we will be impaired in our mitochondrial enzymes and carbohydrate and fat metabolism. If we combine that with inflammation and bad membranes that are easily inflamed, now we get a predictable metabolic picture. You're going to fail metabolically. So you're going to get fatigued. As you get fatigued, again, there's actually something that happens in the endocannabinoid system, and a metabolite called 2-AG kind of takes over signaling over AEA. And as soon as that happens, you're going to have metabolic syndrome. So you're going to trend toward type 2 diabetes. Your fat cells are going to store. And again, this is simple. It's related to B vitamins. All right. Blood, nerves, and brain. So again, and this is just without essential nutrients, people. Okay. This is why it's so important to have essential nutrients. Okay, so what happens in the blood, nerves, and brain? Well, anemia and B12, folate, and B6. So guess what? If that happens, now you're easy to infect, and iron, you're easy to infect. Neuropathy, cognitive mood issues, higher seizure threshold problems, and then an infection. So this is the big one. When barriers fail and immune signaling becomes noisy, you don't just get more infections, you get persistent, recurring, hard to clear patterns. So recurring sinus infections, chronic GI infections and overgrowths like SIBO, more post-viral syndromes and prolonged recovery. Should the flu affect us in the way that it does? No. We're also immune weak because, again, we don't have our essential nutrients. You don't have the gas and oil to run your vehicle. How in the world are you going to fight the flu? Barely. And is it going to cause more harm? And is it going to be worse than it should be? Yes, it's obvious, right? Okay, so what the population's disease would look like, big picture. You'd see a society with high childhood allergy, asthma, eczema, and GI dysfunction. Gee, are we seeing that in our kids? Yes. Early onset metabolic syndrome. We've got a whole industry around semaglutides and metabolic syndrome and diabetes. And diabetes, I think, is a $10 bajillion industry or something. So it's a very large industry that's developed around metabolic syndrome. You're spending a lot of money to look better. And again, why? Because you don't know what your essential nutrients are. Pain and fatigue syndromes. How many of you guys are in pain, right? And again, this is directly related to nutrition and essential nutrients. Mental health instability. Most people think of the way that our mind works as a long way from nutrition. Well, guess what? I can cause you to have mental breaks just by denying you certain nutrients. You make dopamine and serotonin, which helps you balance your mind and your, emotions. And without those things, you're going to not be as balanced as you should be. It's just that simple. Accelerated connective tissue and dental breakdown. Should you lose your teeth? Should your teeth go bad? Should your gums get all whacked out? No. Again, that's essential nutrients. High medication burden. So again, if without essential nutrients, you're not able to build all of these midline things that you need, like a CoQ10 or like enzymes, acid blockers, antihistamines, SRIs. So you're not able to do the things that these drugs are kind of designed to plug in. put it this way, if without essential nutrients, I know exactly what's going to happen to you. Will you have high blood pressure? Yeah, a certain percentage of you will. Will you have high cholesterol? Yeah, a certain percentage of you will. Now I can just build my funnels and my drugs. And again, I don't want to overly criticize pharma, but that looks like exactly what was done. Okay. So let's look at this. And what would happen to the same population? Don't have to do anything else, but just restore omega-3 and omega-6 balance, restore adequate protein, restore adequate collagen, restore vitamins, trace minerals, and metals. Short answer, the disease pattern would unwind in reverse order. The population would look younger, calmer, more resilient, and less inflamed without needing exotic drug interventions. Okay. So the first thing to recover are membranes, and this just takes weeks. Okay. So again, EPA and DHA, TrueMedics, go get it. In fact, get the whole essential nutrients package, because we give you all this. You don't have to worry about getting it from your food anymore. Okay. So you still need to eat some protein, some meat, but then past that, we're going to give you everything that you need in that essential nutrients package. So you don't have to worry about it. And I get asked all the time, Chip, can I eat for this? Can I eat for essential nutrients? No, you can't. The food supply is not good enough. So you're going to have to find an EPA and DHA supplement. You're going to have to find a protein, stomach acid, collagen type, booster and supplement, which is our GI Rebuild. And you're going to have to find all of the vitamins that you need, all the trace metals that you need, and all the metals that you need. And again, that's all in our multivitamins. So if you kind of stick with us, you don't have to really worry about all that stuff. You're going to get it. But look at what happens. So when you rebalance omega-3, omega-6, your baseline inflammation drops. The immune system calms down and is able to resolve itself. Your nerve firing thresholds normalize. So if you have diabetic neuropathy or know somebody who does, again, it's directly related to membrane status. And this is something that we can turn around in weeks, if not months. Okay. So this doesn't take forever. It's something that'll turn around real quick. Your gut lining turns over every 3 to 5 days. Okay. So you can completely repair your gut lining or begin to repair your gut lining in 3 to 5 days. It doesn't take long. All right, barrier tissues start repairing themselves within weeks to months. So with adequate protein, vitamin C, B vitamins plus minerals, high turnover tissues finally get enough building material. But if you're denying yourself B and C vitamins, adequate protein and minerals, you're not going to be in front of your tissue repair. Your tissue will be degrading, not, restoring itself. So what does this do in your gut and mucosa? Improve stomach acid and enzyme production, thicker mucus and epithelial layers, better mineral and amino acid absorption. So you can't absorb, if you think about something that's inflamed on the outside of you and all gross and pussy and all that, can you absorb things through there? Maybe, but not like normal tissue, right? And that's exactly what happens on the inside. Puffy, red, inflamed, can it absorb? Not like it could if it was healthy. So better mineral and amino acid absorption, which creates more of a kind of a positive feedback loop, and reduce reflux, bloating, and food reactivity. So as this comes back more into line, the bloating, all of the things that we're kind of all experiencing now as a society goes away. Skin and airway and urological, so fewer rashes, infections, UTIs, less chronic sinus congestion, and reduced allergic sensitivity. As our connective tissue rebuilds, again, structure returns, and this takes months, but again, this is going to take collagen, glycine, and vitamin C, plus copper, zinc, and magnesium. Those allow the scaffolding. But joint stability improves, reduced tendon pain, stronger gums, connective support around the teeth, faster wound healing, improved posture, and reduced fragile energies. Pelvic floor and fascial tone improves. As metabolism relocks into efficiency, and again, this takes a little bit longer, but Insulin sensitivity improves. So again, we're going to, essential nutrients are going to improve everyone's insulin sensitivity. Triglycerides drop, HDL improves, fatty liver trends reverse, energy becomes steady rather than spiky, exercise tolerance improves without crashing. Blood, nerves, and brain normalize. So again, if you have somebody in a Parkinson's-like or dementia type situation, again, this is how you turn it around, but it is a little bit slower. But again, you're going to see improvements in those person, over weeks, over months, and then big improvements, up to a year. Anemia will resolve, neuropathic symptoms fade, brain fog clears, mood stabilizes, ADHD-like symptoms often soften, sleep architecture normalizes. So this is kind of where I'm at right now, Cindy and I, in kind of our recovery. So we're seeing these things begin to restore that have been the B12, the folate, and the iron handling. And those things we've seen be in a degraded state with us, but we're a little bit, let's say, in front of most people in this essential nutrients. And we're beginning to, see this thing that happens in months and years turn around after, let's say 6 months of very consistent essential nutrients. And the other thing that we're realizing in essential nutrients is really none of us get enough protein. So it depends on how far, let's say, down the ladder you've climbed in this malnutrition. You may need more protein, and that's just, kind of the variable that we're finding. But certainly our products are working really, really good. Immune competency rises. So again, your immune system is going to get stronger and better, but this will take months to years. So you're going to get fewer infections. When you do get infected, you should burn through it really quick, a couple of days rather than weeks or whatever. Definitely reduce cancer risk. So it's, you're at great risk, let's say, for cancer without all of these essential nutrients, and your body doesn't, your body's just kind of slowly burning through all the nutrients that it has until it can't do anything, and it triages nutrients. But cancer would be an extreme, malnourishment, extreme infection. And again, you walk yourself right out of the risk for cancer with essential nutrients. Okay, so what would this look like big picture? Lower childhood asthma and allergy rates. So the very thing that we saw, failing without essential nutrients begins to recover with. Dramatic reduction in metabolic syndrome. So the answer isn't semaglutides and more Ozempic here and gee, give me my stuff. It's essential nutrients. It's just doing what God designed us to do and how God designed us to work and nature to work. So just getting back to nature, really. Later onset of chronic disease. So would chronic disease still happen? We really don't know because we've never optimized around essential nutrients. Well, we don't know. We might not even suffer from chronic disease if we're meeting our essential nutrient needs all throughout life. Higher physical resilience across our lifespan, absolutely. Lower healthcare utilization despite aging population. Gee, you want to save some money in Medicare, Dr. Oz? Well, it might be a good idea just to teach people what their essential nutrients are and get them to take their essential nutrients, because that will save us a lot of money as a nation in our Medicare, Medicaid, and what we're doing in CMS. Reduce polypharmacy. So still a need for drugs, probably, but not as many as we have now. And drugs are really going to be very serious genetic conditions at acute and traumatic care. So again, if I get run over, don't give me turmeric, take me to the hospital and, treat me with drugs, please. So acute and traumatic care are where pharma sings and, hospital systems sing. But not so much in day to day. So reduce polypharmacy, and then better fertility and pregnancy outcomes. This is really cool. Why would you not get pregnant? So if you're a female out there and you're, ready to go, you're ready to get pregnant, you and your husband or your significant other want to have a baby, why would it be hard to get pregnant? Well, again, if you're malnourished, if your body isn't capable of providing complete nutrients to a fetus, you're not going to get pregnant. If it's barely able, you can get pregnant, but that's not a very good thing to do to that child or start that child's development with. I think I'll start my oil and gas adventure in my car without oil and gas. You're not going to get very far down the road. And that baby is going to be deficient right off the jump. Okay. The other thing that happens is the endocannabinoid system is intimately involved in how you get pregnant. You won't get pregnant without CB1 neuroreceptors expressed in the cells in your uterus wall. Okay. And, there's ways to do that, to force that. But again, it's better to let your body decide that, because your body is making decisions based on your essential nutrients. And if you don't have enough essential nutrients, your body is not going to let you get pregnant. The other thing that happens in pregnancy, and this is more infection related, but when you get pregnant, well, let's explain it this way. So when I make a cell, I put a little name tag on it. Blah, chip, blah, chip, blah, chip. My immune system, the way it works is it's just looking at cells. Does it have a name tag on it? Does it have a name tag on it? Does it have a name tag on it? If it doesn't, I'm going to go through a series of progressions of things, but I'm going to attack it first of all. If I can't kill it, I'm going to remember it and I'm going to build antibodies against it. But that's kind of the long and the short of what happens. Now, if you're a woman and you get pregnant, again, your little fetus is not putting your name tag on its cells. It's putting little fetus name tags on all its cells. So what does your immune system think? That's not me. And under normal circumstances, you would attack those cells. You would try to kill that fetus. So that is why you spike something when you're pregnant called progesterone that shuts off that entire killer side of your immune system. Now, how many of you all are on hormone replacement therapy? Some of you, a lot of you, women, especially if you're over 45 or 50, you're probably on progesterone. If you're on progesterone, you're going to be infected with parasites. Why? Because half of your immune system is shut off. The immune system that you need to fight against parasites, off. You turned it off when you started taking progesterone. Anyway, but with essential nutrients, all this comes back on teaching moment there on what we do and the silly things that we do to ourselves. And if you're a doctor that's prescribing hormone replacement therapy, you have to understand the risk that you're putting your patients under. Okay? You have to know every time you prescribe that progesterone, I'm going to shut off half of this person's immune system. Are they capable of handling that? Is that a good thing to do? Are they already sick? If they're already sick, no. If they're taking their essential nutrients and robust, then maybe it's something to consider, but everyone needs to understand the risks associated with that, right? And we're not doing that right now. We're not even telling them, we're telling institutional truths in the pharma and medical system. We're not telling the truth at all. Slower biological aging curves. Really interesting. Looking like in ancient Egypt, they had all this figured out. They had essential nutrients figured out. They were, eating the right stuff. They were using plants for medicine. They had even gone and cannabis as a plant, as a medicinal plant, let's say, was not in their pharmacology at all. So it didn't exist in Egypt. So it was not something that they had access to. They went and found it and cultivated it and used it. But anyway, when you dig up ancient Egyptians, they all look like they're 35. And you think, well, did they all die at 35? And you start asking those questions. And of course, archaeologists will say, oh, yes, they all died at 35. They had bad, practices and died of disease and malnourishment at 35. Oh, really? How come their teeth look like they're 150 and their bones? So again, once we get this figured out, cells are striving to a maturity point. Again, perfect, so to speak. Once they hit that, they're going to stay there. What should that look like? Probably 30 if you're a male and 25 or so if you're a female. I'd like to look that way again. And as we get this figured out, we will. If you started a child right now with their essential nutrients, every day they got their essential nutrients, how would that child's life go? What would that child's disease profile look like? How would they age? We don't know because we've never done that. We've never done that. Okay. But we need to do that. We need to begin to see. And so that's why we work so hard with things like Truth in Health to educate, right? To educate lawmakers, to educate decision makers, to educate policymakers about these very important health things. Do you think your local medical association is going to be out doing these things? No, because it threatens the entrenched system, right? Do you think pharmaceutical companies are going to be out there educating you on natural products and the fact that you need to take them? No, they're not going to do that. Do you think physicians are embarrassed by the fact that they don't know what essential nutrients are, and researchers? Absolutely, they are embarrassed. But we need to change this. I can't change this on my own. You can't either, but together we can change this. So that's what we need to do. We need to stop the insanity, right? Isn't the definition of insanity doing the same thing again and again and expecting different results? Well, look at what we're doing. We spend more money on healthcare than any other nation in the world, and our results get worse and worse and worse and worse. That is the very definition of insanity. So let's stop that. Let's stop that. All right, we'll leave it there. Thank you guys, and we'll be back. I don't know if it'll be next week, but it'll be soon with another exciting version of Chip Talks Health. We'll see you guys. Bye.